Scalers are defined by name or number. They can be universally used on both sides of the mouth, top and bottom, as their blades have sharp edges on both sides. Some scalers, like this sickle-shaped U1530, have unique pointed blades that access particular teeth. In this case, the tight confines of the lower incisors. Some curettes are also universal in use, with cupped edges on both sides of their blade. This 4R, 4L is an example, and can be used throughout the mouth. Other scalers are designed with an edge on only one side of the blade that allows access only from particular angles, as demonstrated here with the two-sided Gracie curettes for front teeth, bicuspids, and molars. One end treats the right side, the other the left. Adequate instrumentation of the entire mouth requires this assortment of curettes. Air-driven ultrasonic tips are used in conjunction with hand scalers. Using sound waves higher than 25,000 cycles per second, their tips effectively dislodge gross dental deposits. Water cools and irrigates the area during their use. Ultrasonic scalers are sterilized between uses in the same manner that dental handpieces are. The potential for aerosol generation is very great, so high volume evacuation is needed when using ultrasonic scaling. Many doctors also like patients to first rinse with an antimicrobial rinse like the Periodontics brand, which reduces the number of disease-causing germs in the mouth. Still, it's prudent to restrict the use of ultrasonic scalers to patients that are free of airborne illnesses like tuberculosis and the flu. The ultrasonic tips have just a few different shapes. It's very important to note that they're not sharp, so when reshaping is needed, a gentle triangular shape helps recreate the edge. After scaling and curetting is completed, treatment ends by polishing the teeth. A slow-speed handpiece with a prophy angle and a rubber cup is used. As mentioned before, paste selection is at the discretion of the dentist or hygienist. Remember that the slow-speed handpiece and its attachments must be properly sterilized and then lubricated before being used. It's recommended that, if available, disposable prophy angles be used. Periodontal surgery uses a variety of unique and unusual instruments. All of the items gathered for non-surgical care are included in the surgical setup: the anesthetics, scalers, curettes, the ultrasonic cleaner, and others. Because of periodontal surgery's inherent greater bloodiness, patients often are draped more extensively, and you may do this with surgical towels. Additional instruments needed, in the approximate order of use, are the scalpel handles and blades, which are seen being assembled here, and the periosteal elevator. These are used collectively to reflect the gingiva and to allow access to the underlying bone. Tissue forceps are much like tweezers, except they have small teeth. They're used to grasp the gum tissues and to help hold them back during treatment. They must be used carefully and gently to minimize damage. Surgical scissors, also called festooning scissors, remove disease segments and help return the normal scalloped shape to the gums. If bone recontouring is required, hand instruments, the air-driven handpiece, or both may be used. Hand instruments typically include plier-like rongeurs whose sharp beaks snip shards of bone away, and small bone files, which, when used in a push-pull fashion, eventually further smooth and plane the bone back to its normal shape. Finally, the suture materials are added to the setup. One of the most important periodontal diagnostic aids for the dentist are the X-rays. Just as pilots use radar to help them see where they're going when it's cloudy or dark, the dentist uses the X-rays to know what to expect beneath the gums when performing periodontal surgery. A panoral X-ray and a full mouth X-ray series usually take care of most needs. Sometimes, though, when the bone loss is so great that its height is not seen on regular horizontally placed bite wings, vertically placed bite wings are needed. Appropriately, these are also known as periodontal bite wings. No new exposure technique is needed when making perio bite wings. Simply orient the film's long axis vertically, as shown being done here. Review the X-ray video for the basics of making periapical and panoral X-rays. As dentistry eliminates dental decay, it'll turn its attention more on periodontal disease. A consequence of not needing dental treatment for cavities can become a complacency about oral hygiene in some people, and the result is an increasing occurrence of periodontal disease in the general population. As dentistry has entered the early 21st century, the challenge shifts from dental decay to gum disease. In time, with the growing wealth of knowledge about its disease process, periodontal disease will also eventually be cured. It'll only happen when dentists, hygienists, assistants, and patients all do their part in eliminating the disease. By doing your best in caring for your periodontal patients now, you're contributing toward this elimination of periodontal disease. Remember, we can only help patients heal one at a time. Do your best each time.